today we should be having more than 6 million women of reproductive age that are on contraception in the country. That's remarkable progress.
USAID believes in the current strides by government towards ensuring a total market approach to family planning access and use, as enshrined in Nigeria's FP 2030 commitments and the National Private Sector Engagement Strategy, which will bring about saving the lives of thousands of women, girls, boys, and men in our communities.
And our mandate is to ensure a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. It helps us to move forward the agenda for family planning, but it also enables us an opportunity to bring young people, innovators into the mix to ensure that they play an important role, not only to advance family planning, but also to fulfill their potential.
Part of what our commitments are is that we will be a great collaborator to the Federal Ministry of Health and the other partners to move this discussion forward. If you look at the brochure that was shared, the conclusion said that the best time to invest in family planning was yesterday, and the next best time to do that again is now. So it's a call for action.
So at DKT, we are very passionate about anything that has to do with innovations. We are happy to be part of collaborations with the Federal Ministry of Health and every other partner here. And family planning is moving to the next level, and that is engaging the youth who are taking this to the next level. We know that they are the rulers of today, not tomorrow.
We have the home-based healthcare services for those that can afford to pay for family planning services at the comfort of their homes. Then we have the community outreach services, where we work with the government and with donors to deliver specific free family planning services to communities. And also, part of what we do as part of that is that we also train community health workers, and we distribute the popular family planning handbook to community health workers. We discovered that this handbook exists, but most people don't have access to the handbook because they don't even know that it's there. So we request this handbook from WHO, and then we distribute it to the community health workers working with the government. So that is the first model of our intervention.
Kiakia Health is a tech-based platform that provides instant access to sexual and reproductive health services. Now, Kiakia Health took it a step further beyond answering their questions. How can they access care? If we set up a center and say this is the center for contraceptive, after a while, everybody knows that when people go into these spaces, that's what they're going there to access. So the stigma continues. So we came up with the concept of veiled clinics, where we partner with value-aligned, non-sort of signaling centers. So some of our partners are dermatologists, dental centers, just about regular places you can go into and nobody cares what you're going in there to do. While our skilled health professionals who know how to deliver youth-friendly, non-judgmental services are able to provide those in-person needs that they need. Over time, we're able to also realize that this could also be a vehicle for talking to them about other SRH. So a young 19 or 18-year-old calls you, how do I use contraceptive? And then you say, okay, this is how you can use it. Have you thought about how you can screen for STIs? Have you thought, do you know your STI status? Have you ever checked yourself for HIV, hepatitis? And this conversation leads to that. Some of them now requesting for self-testing kits. How can they test along with their partners? So basically, that's how we operate. People can access us. We have very youth-friendly team members, and then we use the concept of veiled clinic to deliver, to navigate the stigma that young women usually experience when they want to access care.
So what is the key features in MedBot Family Doctor? One of it is the USSD approach in such a way that when you dial 080 MedBot Family Planning, you can listen to an assistant who will walk you through the procedures of family planning. And also you can dial *371, which will actually now walk you through some of the methods, the ones suitable to you, and how you want to opt in. And if you press 1 to opt in, you receive an instant message linking you to primary healthcare center around you to follow up with your family planning steps. Another one is the conversational chatbot for busy women professionals, someone that is in the bank, someone that works in the bank and does not have even time at hand to go to hospital or nearby private healthcare facility to uptake this. You can get the consultation together with even your partner using a chatbot. And lastly is the provision of the primary healthcare center, the NHIS and HMO. We understand that 40% of people uptaking family planning actually uses private sectors, and some of them who works in corporate organizations as HMO providers. So you can actually now link this up and use it to take up your family planning services.